Hello, everybody. My name is Dr. Corey Hartman. I'm a board certified dermatologist based in Birmingham, Alabama, at a practice called Skin Wellness Dermatology. And I'm also on the faculty at the University of Alabama, Birmingham School of Medicine, Department of Dermatology. And I'm joined tonight with two of my friends and colleagues as we get social about cosmetic procedures in skin of color. I'm going to hand it over to Dr. DiAnne Davis and then Dr. Michelle Henry so that they can introduce themselves as well.
Hello, everyone. It's great to see you. I'm Dr. DiAnne Davis. I am a board-certified fellowship-trained dermatologist. I practice both medical and cosmetic dermatology in Southlake, Texas at Hopkins Dermatology. And I'm super excited to be here with my friends and colleagues and have some fun tonight.
Hi, everyone. I'm Dr. Michelle Henry. I, too, am a board-certified dermatologist and Mohs surgeon practicing in Manhattan, New York. I'm the founder of Skin and Aesthetic Surgery of Manhattan. I am a clinical instructor of dermatology at Weill Cornell Medical College. And I also run a research group that focuses on optimizing aesthetic treatments in skin of color.
So we want to thank you all for joining us tonight. We are very excited to be together. Whenever we get together, it's a good time. We always share knowledge, learn from each other, and hopefully we will share some of that with you tonight and you'll find it beneficial. If you have any questions, please leave them in the comments section of the chat, and we will get to those throughout the discussion and hopefully make this very conversational for everybody so that we can all get something out of it. So we're going to jump right in. And tonight, our real focus is common skincare concerns in patients with skin of color. And we've taken three big chunks to discuss, and we're each going to tackle one of them. First is dyspigmentation, post-inflammatory hyperpigmentation, melasma, sun-induced hyperpigmentation. All the dyschromias come under this umbrella. And we have Dr. Henry, who's going to tackle this one and go through a case of how she successfully treated a patient who was suffering with dyspigmentation. Then we're going to dig into scarring a little bit. Scarring, of course, you know that word can mean a lot of different things. Tonight, for tonight's purposes, we're really going to be focusing on acne scarring, but keloid scarring is an issue as well. Any of those textural changes that occur after an inflammatory process in the skin is under this umbrella, and we're going to talk about it. And then we're going to let Dr. DiAnne Davis tackle that one. And then signs of aging. I'm going to do this one. We all start to see loss of collagen, loss of elastin. We see those structures that really hold us up and support our faces start to, not do that as much as we go through life. So we'll talk through some strategies and ways to reverse some of those changes that we see. And when we talk about these things, we also want to make sure that we include integrated skincare and why this is important. We know that, these procedures in skin of color are not without risks. These are all, I like to call them controlled injuries to a certain degree that we know how to manipulate for good purposes. But without that, we can get into some trouble. So we want to do that to reduce post-procedure downtime, decrease healing time. And I'd like to just get the opinion of my fellow panelists on what that means for them and how they incorporate integrated skincare into their procedures. DiAnne?
So I think that's a really good point that you make because, of course, we want to make sure that we're maximizing the procedures for our patients. So I explain to my patients that we're going to start with a pre-procedure regimen. Sometimes it may be either increasing cellular turnover, removing some cellular debris. Maybe it's a lightening agent to minimize, potential risk of hyperpigmentation, because we want to make sure that their skin is prepped and ready to go. And then also it's ready to go through the healing process that we do after the procedure.
Yeah. I agree. I think it's so critical at both stages. So in your pre-treatment, especially when we're doing lasers, we kind of call it kind of like prophylaxis, pigment prophylaxis, to make sure we're not getting a lot of inflammation and getting hyperpigmentation afterwards. So just as Dr. Davis said, that's absolutely critical. And then when we're after the procedure,
Oh, I think we lost Dr. Henry.
Dr. Henry?
I think maybe she's just going to pop back in. Maybe
okay, we'll give her a second or two.
Okay. I was going to say, though, and I think one of the things that Dr. Henry might be commenting on for post-procedure integrated skincare is I always tell my patients, you want to protect your investment. Once you've made
Absolutely.
once you've made the investment, you spent the time, the money, the downtime, you may have to take off work. You want to maintain those results. So this is why, sometimes I do get questions from patients where they're like, okay, do I really have to do this? And, I say, well, you want to protect what you just paid for. So let's make sure that we've got a good sunscreen on board, maybe some other topicals, just to make sure that their results are going to be not only enhanced, but maintained.
Yeah, I like to tell people, look, you're buying a Mercedes, we're going to make sure we change the oil. So these are the steps that we're going to do to keep this investment intact. So yes, there she is.
There she is.
Yes, I heard the Mercedes comment. That is fantastic. I'm going to borrow that one. But that's exactly what it is. You're making this investment. We want to make sure that we take care of our investment. And also, with Skin of Color, a part of it is we have to take I would say we go low and slow, right? So we can't really blast you with the energy because we don't want to burn the skin. So how we optimize your treatments are making sure you have excellent skincare so you can get really fantastic results without having aggressive, really dangerous treatments.
And ladies and gentlemen, that separates the good from the great. With that, we are going to we're going to move into our first case, which is Dr. Henry's discussion on melasma.
Excellent. So yes, this is melasma. So we see a lot of pigmentary conditions in Skin of Color. So when you see a patient that has hyperpigmentation, it can be many things. Of course, this is really classic melasma, and I'll talk about why, but it could be post-inflammatory hyperpigmentation. It could be drug-induced hyperpigmentation. A lot of the medications that we take for hypertension can cause hyperpigmentation. There is something called, it's pigmentation with being mature. So as we get older, we get this pigmentation on the cheeks. It's really distinct, particularly in Skin of Color. So there are many reasons. So why is this classically melasma? So there are a few features that you see. You see it's more on the center of the face. So when we're looking at other types of pigment, so pigment from maturity, we're going to see it more on the lateral face. We see that it's sparing the periorbital area, so the area around the eyes. We see that it's sparing the nasolabial fold, so right around the nose, so those parentheses around the nose and mouth, it's sparing those areas, and that's really classic for melasma. And so this patient came in with a really tough case. She's also on hormone therapy. So with melasma, you can see it for any reason, but classically we called it the mask of pregnancy because we often saw it in pregnant women because of those surges in hormones. And so with her, she's on hormonal therapy and she's refusing to get off of hormonal therapy. And she also is a little bit of a sun worshiper. So all of those things that trigger melasma are going on here, and we're really battling against it. And I think this is a really classic case that shows the importance of not only great treatments, but also integrated skincare. So what I started out with her first, I started treating her with my Pico Shore laser. So this laser is a picosecond laser. So it's going to go in, target that pigment. It moves so quickly that you're not going to get as much collateral heat. So it's safe for all skin types. These patients, you don't see the clearance immediately, but after about 3 or 4 weeks, as the immune system clears out that pigment, they start to look better. So we're doing a series of those treatments. I did pre-treat her prior with hydroquinone. So she was already on hydroquinone, and I do a pretty high compound. I do 12%. We mix in some other ingredients, vitamin C, kojic acid. We pre-treated her with that. After a few sessions of the laser, she was getting a lot better, but not perfect. So we knew we had to integrate some additional treatment. So I started doing some chemical peels on her. So light chemical peels in addition to her skincare. So I had her on some kind of regenerative treatments to make sure she had good healing post every energy-based treatment, but also after her peels. So we started integrating some peels. I added some cysteamine as well to her treatment in addition to her hydroquinone. I find that when we finally stop the hydroquinone, patients flare less if we have them with something in the background. Of course, fantastic barrier protection with really great creams at night and in the morning, and sunscreen. So she did beautifully. The after photo that you'll see is probably about 6 months in of combination therapy with excellent skincare. And this is a woman who is on camera. So the melasma was difficult. She wasn't really able to even cover it with her makeup. And so this was a huge improvement for her. And again, this is without doing any oral therapy and without stopping her oral hormones and sunscreen. This is just religious, a really great patient that was religious with her visits and religious with her skincare. And I think it really is a fantastic example of what we can do when we integrate our lasers, our treatments, and great skincare at home.
Absolutely. Michelle, I have a question for you. So when you're using hydroquinone, do you limit the use of hydroquinone? I too, like you, use very high doses of hydroquinone because sometimes we need it.
Yeah.
But I'm interested to hear your thoughts and your outlook on limiting it or maybe integrating it with other topicals at the same time.
Yeah, so I slowly graduate. So I start out with every other night for about the first month, and then I go up to nightly, and then even twice a day if I need to. I tried to limit it to about 3 months before taking a break. I know some use 2, but with 3, I've not seen any issues. I find that going high and fast, so the opposite of lasers, high and fast with hydroquinone is better than going low and slow. I see more complications in patients that have been using 2% or 4% for years and years and years than 12 or even higher and for a short period of time. So that I have a similar approach.
I totally agree with you. And I think that it is also important to get the buy-in of the patient. So for them to see some improvement early on is important to getting them to be more compliant and to really understanding what you're trying to do. So
Yes.
excellent case. Very great improvement. And there we see the before and after next to each other so we can see how striking that is. And any of you who treats melasma out there knows that this was not easy to accomplish. Yeah. So hats off to Dr. Henry.
Incredible results, Dr. Henry.
Yes, incredible results. And also, we also want to always stress the importance of continued maintenance. So she is not cured. This is going to take maintenance to keep these results up.
Exactly.
Nice.
Thank you.
All right, we're going to hand it over to Dr. DiAnne Davis next, who's going to do a case on acne scarring.
Okay, so thank you. So this is a Hispanic male, I believe he was in his late 20s, who came to see me. This is when I was actually doing my cosmetic fellowship in Salt Lake City, and he came to see me for acne scars. And acne scars can be challenging for several different reasons. One of the reasons is because there's different types of acne scars. So with this patient, we have some boxcar acne scars, but he has a lot of rolling acne scars, which is where you can see that the skin topography is not really smooth. It kind of has some hills and valleys, or it looks different in different side lighting views is how I explain it to patients. But you also have boxcar acne scars, which could be some of more of the kind of etched out demarcations on the skin that you may see. You have ice pick acne scars, which are kind of like sometimes the tiny little dots. And then also too, some people refer to their post-inflammatory hyperpigmentation as acne scars, or some people may have post-inflammatory erythema or redness or pinkness, and they may refer to that also as their scarring. So it can be really challenging to treat, but I do love to talk with my patients because the other component that we have to realize with acne scars is that it can really affect the patient's quality of life and their self-esteem. It's a constant reminder of the acne that they may have previously had. And so I really try to make sure that I'm listening to my patients and also assessing the different types of acne scars to make sure that I can give them a comprehensive plan. A lot of times when I have a patient who has come to me, such as this one, and we've had, he had several different treatments prior. Microneedling is one treatment that can be utilized for acne scars, depending on the severity. But he had several treatments of that and was looking for something to give him a little bit more improvement. Where I did my cosmetic fellowship, we actually were pretty aggressive with how we treated acne scars. So because this patient still had some acne breakouts and had super oily skin, one of the pre-procedure considerations that I do as a board certified dermatologist is if they're super oily, I will put them on oral isotretinoin, or what we still refer to sometimes as Accutane. And so in the setting of course, proper training that we have as dermatologists, we know that we can do procedures on our patients that are taking that medication. And there are certain ones that we can do. There are certain ones that we stay away from. But because he was so oily and we were going to do an acne scar surgery protocol, his aftercare was going to include a lot of ointments and grease. And I didn't want the patient to get new acne breakouts because then we have more acne scars. So that was one of my pre-procedure preparations. Also just making sure that my patient is going to be extremely compliant with sunscreen. He's of skin of color, he's a Hispanic male. So I need to make sure that we are going to be maximally compliant with our sunscreen, and then just making sure that he's also compliant with an overall skincare regimen that will include cleansers, active ingredients, and moisturizers and such. So for his plan, because he had rolling acne scars, but also some boxcar acne scars, I wanted to approach them from both the top of the skin and underneath. So I actually recommend subcision, especially for the rolling acne scars, where I actually go underneath scar bands. And so when you go underneath the skin to break up those scar bands, it's almost as if you're releasing that kind of thread that may be holding down the pincushion type scar, if you will. But of course, I want to attack his acne scars from the surface too. So I love fractionated laser therapy. It's where we're creating tiny little injury zones in the skin that's going to stimulate your skin to make new collagen that's younger, fresher, and tighter. For this particular patient, I did use an erbium laser for fractionated therapy, which can be a little bit more aggressive, especially for my skin of color patients. I feel very confident with this laser treatment. I did a cosmetic fellowship for that reason. And so, of course, it's also just guiding the patient on what he's going to experience post-procedure. Because the acne scars are primarily on the cheeks, I only lasered the cheeks, but I wanted to make sure that the patient had a comprehensive healing process with his skin. So I also did a chemical peel to his entire face so that everything would kind of peel together. So this is 3 different steps: chemical peel, subcision, and fractionated erbium laser resurfacing that I do all on one day. And I find, and what we know from our literature, is that by doing a combination of procedures, they provide synergy and give better results for the patient, which I think we're going to see his after pictures. So this is his after picture. Hopefully everyone can see. Of course, this is about 2 weeks later. And so with his healing regimen, he was not able to keep his beard cut short. So we have that. But you can definitely see the improvement in his just overall skin surface and topography. These photos are actually, I said 2 weeks, but I'm sorry. These photos are actually about 2 months out. But you can really see the improvement in his overall skin texture, the acne scars, and you can also just see even just a little bit more confidence in just, just how the patient overall looks. And I find this to be a great procedure to offer for my patients who are okay with a little bit of downtime. I mean, this downtime includes about a week of not leaving the house. Some people can do that and some people can't, and so I understand. And then, of course, his aftercare regimen is going to continue with sunscreen and also a acne regimen or acne prescriptive medicines that are going to ensure that he doesn't get new acne breakouts where he's getting new scars.
Excellent. So you did 3 different treatments, 3 different times all together.
Just one time. So this is a one and done.
Wow.
Yes,
Gotcha.
one and done.
A one and done. That's remarkable for one treatment. Excellent.
Mm-hmm. Thank you.
Great results. And did you do any sort of management of pigment with topicals throughout this process?
So it's interesting. Sometimes I will, and especially with my skin of color patients, but where I did my fellowship training, we actually would not necessarily do lightening agents prior to the laser procedures. I usually would just have a very candid discussion with the patients based on their skin type that they may notice some darkening of their skin. The best thing that they can do is initially, right after that treatment, make sure that they are out of the sun. And once we have their skin re-epithelialized, then of course they can use their sunscreens, maximally protect. Sometimes I'm even like, carry a black umbrella while your skin is still kind of pink or red as you're going to and from the car, just because the sun just loves lasered skin. So I have to really kind of just have a come to Jesus, talk with them. And then, of course, I always tell them if there's a little bit of pigmentary alteration, then I can always clean that up with either a pico laser, like Dr. Henry said, maybe a light little chemical peel or some topicals.
Yeah.
I love the tip about the umbrella. I think that people underestimate how much they're actually out. I think we've all been told by patients, but I never leave the house. I'm like, well, how'd you get here?
Right.
You know what I mean? And the worst is when you get caught inadvertently out. Like you might get stopped by the neighbor and you have a longer conversation, or your son won that baseball game and now you're stuck out here for 2 more hours.
Yes.
So that's why I like to tell people, look, if you do it every day and it's a habit, you don't have to think about it. You don't have to think about it when you go out. You're always ready.
Yeah.
Excellent. Excellent results. Thank you very much.
Thank you.
All right, so my case is the last one, and we're talking about sagging skin, loss of volume, and I think it's really important here to point out the different ways that people with skin of color present with their concerns with sagging skin and loss of collagen. It's not like lighter skin counterparts of ours who start to have elastosis and sagging and just like breakdown of collagen in the skin that makes their skin texture different. We don't really deal with that. We keep a smooth skin surface. We don't have a ton of dyspigmentation that's solely from the sun. And we tend to hold on to our collagen for longer. So what I like to say is we have better bounce back. But we do start to see that sagging, particularly in the middle of the face. And most of my patients come in and they have some concerns about looking tired or starting to look like they haven't gotten as much rest as they want to, or they're just starting to look, saggier on the lower face. And all that we know starts from the upper face. So keeping an approach that keeps people looking natural is kind of my thing. And once I educate patients on the importance of that, they are more open to the strategies that I come up with to keep them looking younger. Because of the marketing from these fillers that have been out forever, the first filler was indicated for the nasolabial folds, and that's where all the marketing started. And that's the easiest place, or traditionally has been the easiest place to have indications for. So that's what patients have been accustomed to noticing, and that's what they focus on. But we know that that's not always the whole answer. And if you only fill that area, you might make them a little bit happy, but you're not going to give them that overall comprehensive, harmonious face that looks untouched. That really is what they want. So we start to see that she has some temple wasting. She has some loss of fat pads in the peri-orbital area, specifically in the tear trough, which is contributing to a heavy nasolabial fold, and then a marionette area that's starting to suffer as well with some early jowling. These were all of her concerns. And then a little bit of a elongation of the ergotrid, or the upper cutaneous lip, which is causing her lip to hang a little heavy and low. So our approach was to start from upper and outer. I use a cannula for most of my injections. I just find it to be safer, and at this point, a lot easier for me to do. It reduces bruising, and it also helps patients to not experience as much pain during the procedure. I do have patients numb with a pretty strong topical numbing. I don't use Pronox or any of that. We breathe through it. Yoga breathing is really important. All injections are easy when you're exhaling, and I coach the patient the entire time. I also do a little talk aesthesia. God gave me this gift of gab, and I use it. So we started there. What are the considerations for this patient? So that's what the patient came in complaining about. Nasolabial folds and really in the center of the face. But when I explained to her that we needed to start at the temples, she was all on board with it. We also put a little bit of filler in the preauricular area, which helps to elevate the lower face and treat the jowls as well. Pre-procedure, I like to build a good regimen. I believe in the Holy Trinity: sunscreen, some sort of antioxidant, and then a good retinol at night. And we like our patients to be on this at least 4 to 6 weeks before we do any procedure if possible. And then aftercare for filler is really not that, it's not as important to have a regimen for pigmentation, but I do like to manage the swelling so that they can get back to their normal lives as quickly as possible. And I personally do that by using gentle cleansers, keeping off of any active ingredients for a couple of days, using an antihistamine, a non-sedative, for a few days to keep the swelling under control, because all these fillers are going to be recognized as far in by your skin. And if you can subdue that reaction that your skin is naturally trying to make, it keeps the downtime easier to deal with. And then, of course, ice. So this is her after. And I think that we have, let's see, you can see it better kind of side by side. Just an improvement in the temples. The eye area has been elevated and lifted. We didn't do a ton in the nasolabial fold, but we did do a little. The tear troughs and the nasolabial folds, to me, are the last areas that I feel after I go after the cheeks, the temples, and the lateral face. We did a touch in the upper lip just to give a little smoothness and a nice eversion of the lip. And we really built up her chin and lower face as one unit with the marionette lines. And I did all of this with the cannula except the lip, which I think hurts more than just using the cannula. The side view is important and very impressive, I think, as well. As you can see, everything sort of softened up, but it looks natural. It doesn't look like anything was ever done. And that is always my goal. 80% of my patients come back 2 weeks later and like, I think I like it, but I don't know. I don't really know if I see a difference. And then we show them the photos, and that's when they have their big wow, aha, I love it moment. And I tell them, look, you think you want dramatic, but if I give you super dramatic and you go to Publix and everybody's looking at you and pointing at your lips and your cheeks, that's not the kind of dramatic that you want. You want it to be really subtle. And that's what we try to communicate to patients so that they stay in line with what we are going for. So I want to open it up to any questions. And if we don't have a lot of questions, then we can kind of just sit back and talk about our own approaches and things that we think are important. But we can also go into skincare regimens and what you think is important for building a good skincare regimen. What ingredients do you guys like? What are you excited about? I heard Dr. Henry mention cysteamine earlier, which I love. I'm a huge proponent of it. I think that it's good to always have it in the background if you're dealing with any inflammatory skin condition or if you're in the sun a lot, because it can sort of always keep your skin in check and not even let it get to the point that the discoloration comes about. Another new ingredient that I've been really excited about is lotus sprout extract, which is in one particular skincare line that I really like and have been very impressed with. I don't know about you guys, but everybody comes out with all these, new great, miracles for dealing with pigment, and 9 times out of 10, they fall flat. But that's one that I've been really impressed with. How about you guys?
I like the cysteamine. I believe I texted you, Dr. Hartman, at one point, because I was like, okay, should I be using this? Okay, which one do I need to get? What's the best? And I remember when I started using it, I could tell a difference personally with myself. So I also think that has just been a game changer in our industry, within the last couple of years. That is a great, again, hydroquinone-free option for our patients, if we want to transition them to that plan.
Yeah, I like it a lot. I like the versatility. So I have a lot of patients that come in with hyperpigmentation on the lips. There's not a lot that you can use on the lips.
Oh,
I find that's a huge area where it shines. In terms of other ingredients, I'm a retinol girl forever and ever and ever. So retinol is always going to be my go-to. So, better formulations of retinol always gets me a little bit excited. I think we're getting some really great vitamin C's on the market that are more stable, can penetrate better. So vitamin C is always a mainstay. Is there anything kind of sexy that I can think of? Those are always going to be two of my tops.
And honestly, we all do media. We all talk about these ingredients, and I know a lot of these things can be buzzy and they can be interesting to talk about, but I find myself coming back to the Holy Trinity and the tried and true.
Correct. Always.
Anything else.
So, I will mention, Sorry, go ahead. I was gonna say, I'll mention one buzzy thing that I wasn't into initially. And I was like, what do we know about these things? I have started using exosomes topically post laser. And I think it does help with the erythema and redness. And so because of that, I've been using it more and more of my patients of color, hopefully as a strategy to reduce PIH. The jury's still out on that, but I will say that even in myself, I do microneedling radiofrequency on myself maybe every 2 months, 2 to 3 months. And so I know how long I am red. I can stay red for about 6 to 8 hours with my settings. When I use it, I'm probably red for 2 or 3 hours. And so that's kind of been something new that I've been introducing. So kind of buzzy. I was resistant.
No, hey, I'm right there with you. I'm resistant. I'm going to text you later to get the deets because I've been a little skeptical to jump on that bandwagon as well. So it's good to hear an endorsement from somebody that I trust and respect.
Absolutely.
Yeah. And, we're always on the lookout for new things. It's just that we're very skeptical and we are very, we have high standards. So we're not going to let anything just creep in. And I think that patients spend a lot of money on these things and they want to see real results and they're busy like we are. And the majority of my patients don't have time to do 12 steps. So the 3 that I can get them to do, I want to make sure that they are going to see the results that they are going after. So.
Absolutely. And probably one last thing just to remind everyone is to also just be aware of counterfeits across the board. We are seeing that. So please, be careful. Everyone's trying to buy everything off of this website or that website or their cousin's website. Just get it from your dermatologist or get it from the manufacturer themselves.
Thank
It's
you.
scary out
Please.
there.
Yeah, listen, everything is not, some things are supposed to be a little bit expensive.
Right.
Okay.
Yeah.
If you're worth it.
As
Cheap
my,
is not
my
always
con-
attractive.
as my contractor said, who built my practice, he said, cheap is expensive.
Yeah,
You're gonna pay
absolutely.
so much
Oh,
more.
there you go.
So much more in the long run.
Yes.
Absolutely. So, well, thank you guys. This was so great. Always a pleasure to be with you. I hope that everybody learned something tonight, and thank you for joining us.
Bye.
Bye.
Thank you.